and our economy by doing the things that are necessary to stop this spike that we're on now. Currently, the percent of all lab confirmed COVID patients in Dallas County is 11.35% in our hospitals. Now, the numbers I'll show you in a minute will be a little lower than that. They come from the RAC. The RAC numbers are looking at the percentages of all beds in a county, whether or not there is sufficient staffing to actually use those beds. The more accurate number we believe, and we'll be writing a letter to the governor on behalf of the hospitals to point this out, is the number of staffed beds, which is a little bit higher utilization here in Dallas County than just beds that we don't have people to staff. While this number most accurately captures the impact of the COVID patients on the staff, as I mentioned, that's not the number that the governor is using in his metrics. So according to the governor's executive order 32, the metrics calculated by all hospital beds, whether staffed or not. So I want to take a look now with you. We're going to use the governor's numbers to illustrate something for you here. Let's take a look at our regional hospital bed utilization for COVID over the last 2 months. So what you're looking at right here is the first day in October. Okay, you can see it's pretty much a sea of green there. Green is good. Let's go 15 days later. It's getting less green, beginning to look a little bit like autumn. You're seeing some yellows and oranges and reds. Let's go to November 1st. Okay, now we're seeing a lot of red. Red is bad. Let's go to where we are today. Getting redder. So we're on a trajectory, and the way these trajectories work, and we're going to see that in our next slide. Next slide should be well, actually, we'll take a quick look at. Well, maybe we can come back to this slide. Let's go to our. Or I tell you what, let's talk about this slide real quickly. This shows you our hospitalizations over the last couple of months. You can see that blue line there. We took that back for you. We had the medical modelers take it back. They're pretty good at predicting this stuff. There's what they predicted for the last, 15 days. They were pretty much on the money there. That's the blue line that curves into the bars that have already occurred. Now look where that blue line is going. That is where they predict that we'll be going if we don't radically change our behavior and stop all the things that we're doing, bumping into one another and being around one another. And you can see that's going up, pretty high there. Let's go to the, here we go. So this is what I want us to really focus on. I've been using the old model for the last couple of days because this one just came out. So if you're a news station that's looked at those models, this is the brand new model from the medical modelers. It shows that unfortunately our compliance across Dallas County has slipped to 56%. This is masking, this is avoiding crowds, this is social distancing, doing the things that are necessary to keep you and your family and our community safe and keep our economy going. The last time they looked at these models, we were at 63%. The difference in 63% and 56% where we are now is an R0 factor of 1.25. So our R0 factor has gone up pretty dramatically from where it even was last week, where it was, I believe, at 1.09. What is an R0 factor? I realize this is kind of geeky stuff, but an R0 factor is the replication of the virus. When your R0 is at 1, you will replace each case with another case. When it is above 1, your number of cases is growing, and when you're below 1, your number of cases is shrinking. So at 56% compliance and an R0 factor of 1.25, it means that 1,000 cases today will be replaced with 1,250 cases, and that 1,250 cases next week will be replaced with over 1,500 cases. And so it's very important I may be off on the math there, I beg your pardon. But you can see that number will just keep climbing at those are not factors. Now, if you get back to about where we were, which is the orange line, then you're increasing at a 10% increase each week. See where these lines are going as compared to, and I may lose sound here, these are your average daily case numbers, okay? That red line, this is today. That red line will put you at a place where it will be projected that you'll be well above 2,000 cases on Thanksgiving with their slide, with their predictions, and they have been very, very accurate in the past. And so if we can get to where we are at that green line there, 65% compliance, not too hard, folks. I mean, it'll take all of us, but we were well above that this summer. And if we can get back there, we can flatten this thing out so that one case is replaced by another case, not more than one case. Further, if you can get to where you were this summer at a 68% compliance, then 100 cases will be replaced by 90 cases, which will be replaced by 81 cases, which will be replaced by 73 cases, and so on, and you'll get those numbers back in control. But it takes all of us, and so we have some asks, and what we want people to focus on right now is not waiting until Thanksgiving to do this, but go ahead and switch slides. We want people to the fullest extent that they can to begin to telecommute now. We want our employers to look at your workforces. We recognize that there are some jobs that are essential and they require people to be on site. But even in a field where there is essential work in manufacturing, where people have to be in the manufacturing facility, there are people working for the company that could work from home. If you look at the CDC slide here, we know that for people who get COVID and who work, more than twice as many cases in those who work outside the home as in those that are telecommuting. That's the CDC's national data. So if we could do that, if we could look at that workforce, and whether it's 10% or 100% of that workforce that could telecommute, if we can get them doing that now, don't have to do it forever, but if we can get them doing that now in the face of this spike that we're seeing, that our hospitals are seeing, that will help us. And as we do that, here's the conversation that we hope will happen. We hope the employers and managers will say to the employees, I'm doing this because I care about you and I care about this team. And I want us to do our part to keep your family safe and to keep our community safe and to keep this company strong. We don't want COVID spreading through this company. But at the same time, I need you to do something as you go home. I'm sending you home because it's not safe for you to be around large crowds. And so I'm asking that you use this time not to go to large crowds in person, not to do your Black Friday shopping in person, not to invite a bunch of neighbors and relatives over to your house or go to their house, go to a bar, go to a restaurant gathering, but to use this as a time to be around only your nuclear family and to be around crowds just as little as possible while we get this back under control. If we can get to where we've got a 68% compliance with masking, distancing, and not going around crowds, these numbers will start going down. But until they do, we have got to act aggressively to stem the tide of this, or you're going to see numbers like you've never seen before in new COVID infections and in hospitalizations just over the next week to 2 weeks. All right, so that is as strong as we can ask it, and I'm asking that on my own behalf, on behalf of the Dallas County Medical Society, the Dallas Hospital Association, the healthcare workers who are exhausted. They've been working to keep you safe for 9 months without a break. They've worked harder than they've ever worked in their life, harder than any of us probably outside of the field of war have worked in our lives. So one of the doctors pointed out on the call today, and it resonated with me. My father served in the Battle of the Bulge. Obviously, he had me late in life, but or actually, he's an adopted dad. But Ward Jenkins served in the Battle of the Bulge. It was the longest, toughest fight of his life. It lasted 5 weeks, and you know, certainly combat is harder than anything that we're experiencing now. But our medical heroes have been working nonstop for 9 months, and they need our help. So everyone, it's great that we have those signs in the yard. Really, it is. It's great. You know, I make a point of doing this. You know, thank you for your service whenever I see a veteran. Thank you for your service whenever I see a doctor, and I think that means a lot to them. But what would really mean a lot to them is if we can wear our mask and limit going to those crowded places. That's what they need. I was at UT Southwestern yesterday, and people were saying to me, that's what they need. They need you to wear your mask, to limit your interactions with crowds. You can see it out there on the streets. Those of you who are driving, there are a lot more cars on the road. There are a lot more people with COVID fatigue that are doing, you know, more stuff outside the home, and you're seeing it in these numbers. Let's talk a minute about the holidays. If you are considering quarantining or isolating yourself for 14 days so that you can all get together for a big holiday celebration, today would be the day you would start that. But our doctors are strongly recommending, unanimously recommending, and for that matter, so is the CDC, Dr. Birx, Dr. Fauci, that we do not celebrate Thanksgiving in the way that we normally have, where several family units all come together into a home or a restaurant to gather together. Rather, they are strongly urging that we celebrate Thanksgiving with just the folks that we live with. We can Zoom, we can phone call, we can do all sorts of things to reach out to the people who would normally be at our table. But the doctors point out that with these numbers shooting up, it's a precarious time to bring people, you know, over. I know some families, we get a lot of questions about this, have an older adult who lives alone at home, and they can't imagine a situation where they would want that older adult, maybe it's grandma, to be all by herself for Thanksgiving. You've got to consider also grandma's high risk and walk through that. But if grandma is, you know, going to come to your house, now is the time to begin that isolation, all right? Because the safest course is to not come together. The second safest course is to isolate for 14 days, and 14 days before Thanksgiving starts today. And then as an added precaution, and as something that may be the next best thing, but not necessarily a good thing for our essential workers, we are offering, as we always do, free COVID tests. So you could go take a COVID test the Thursday or Friday before Thanksgiving and isolate from the time you take that test until the time that your celebration happens. That's not foolproof. I think Phil will talk to you about some reasons why that's not foolproof, because the tests are not 100% positive. It's not 100% certain you're not sick. It's not 100% certain that you won't be sick by the time you get there. But nonetheless, that is an option as well. But under no circumstances should we have a situation where we bring 3 or 4 families that could celebrate, with each other, normally celebrate with each other, but could celebrate at home together. And as you're looking for where should grandma spend Thanksgiving, it is better for grandma, if she's going to spend it with anybody, to spend it with people who are not working outside the home to the extent possible, who don't have children that are visiting with friends and in extracurricular activities. So if the choice is between, and you know grandmas, they're going to gravitate towards those kids. But if the choice is a household full of kids and people who work outside the home, or you know, some people that they're empty nesters, isolate for 14 days, and those empty nesters are your best choice for how we do that. The last thing before I turn it over to Dr. Wong, I want to remind y'all, we're, what are we now, 12, 13 days in to open enrollment for the Affordable Care Act. So much going on right now. You've got COVID going on, you have the presidential elections, other things happening. People may have forgotten that now is the time for hundreds of thousands of Dallas County residents to look at renewing their insurance. If you don't get renewed by December 15th, then you may be shut out for an entire year. It doesn't just roll over. So if you don't get renewed by December 15th, you may be shut out of getting your insurance. You need to go on the Marketplace website. 9 out of 10 of our Dallas County residents will be eligible for some discount or some subsidy, but they can only get that through going on the Marketplace website or phone number. That website is healthcare.gov, healthcare.gov. The phone number is 1-800-318-2596. There are a lot of folks out there selling insurance, but the only way to access your subsidies is to go to healthcare.gov or that phone number. For 9 out of 10 shoppers, they'll receive financial help. For 2 out of 3, they can get a plan for less than $10 a month. And some shoppers may be able to get enrolled for less than zero, or for zero rather, with their tax credit. So please go on there and do that. If COVID has taught us anything, it's that it's very important that we all have access to health care. And it's important to all of us that you go and find out what's available to you. You can, by the way, go to healthcare.gov. There's a button there that says Find Local Help. And you can click on that Find Local Help, and Parkland or others will help you through the process if you need that help. And so now we'll turn it over to Phil Wong. I'm my mask here.
Good afternoon. As the judge mentioned, the COVID cases are increasing dramatically across North Texas. We are extremely concerned about this situation. Here in Dallas, we've had over 1,000 cases for 3 straight days, and hospitalizations are continuing to increase. Today, we're reporting 808 new cases, but the 7-day average for the last week was 779. So again, much higher numbers than we'd been seeing in prior weeks. If we are still in the red zone of risk factor, and even again, it's since we've been in this last several weeks, the situation has gotten much more serious. Let me go through some of the slides. These are again the confirmed and probable cases by actually, we report these numbers of cases each day, but this is actually corrected by the date that the specimen was collected. So again, you can see that same spike that we saw in early July, late June, the dip then when we had the universal masking and the closing of bars and the number of cases, and then that increase that we've been seeing since mid-September. And now you can see that these numbers are getting to the same numbers that we saw in the peak in July. The last few days, again, we know that there's some delayed reporting, and so those numbers start to fill in. But again, extremely serious when we see these numbers increasing like this. Next slide. This is the available ICU beds and the 7-day trailing average. Again, this is a number we don't want to be low. We want there to be more available ICU beds, but this number has stayed low and continues to be low. Next slide. This is the suspected and confirmed ER visits in the prior 24 hours for COVID-19. Again, similarly, we saw the plateauing, through March, April, May, and then we increased up through July, then decreased, and now these emergency room visits are increasing. As you can see, just a couple days ago, almost 600 emergency rooms in just one day. Next slide. This is the confirmed admissions in the prior 24 hours. These, again, going up, down, and then now it's going back up again. And these are all of these indicators showing the same pattern. Next slide. This is the hospital occupancy. And so, again, hospitalizations have jumped dramatically in the last week. 597 confirmed on this last date, reporting almost 600 in this single day. One thing about that, 163 of those patients are nearly 1/3 of the COVID patients in the hospital are in the ICU. And one thing I want to mention, there's been some reports that we're getting some cases, hospitalized patients from El Paso. This increase is not related to any patients coming from El Paso. North Texas has only received 7 patients from El Paso, so these numbers, again, are not related to anything like that. And as the judge mentioned, the hospitalizations now are at 94% of the peak that we had in July. So next slide. And this is finally, again, the last indicator that trailing indicator is the number of deaths. So we're seeing, slight increases, but those we're still monitoring, and those trail these other indicators that I've been reporting. So as all of these slides demonstrate, it really is a very crucial and critical time in our fight against COVID-19. The numbers of patients in the hospitals, they go up quickly, but then it takes a long time for those numbers to go down. We, as a community, really need to come together to help prevent our hospitals from becoming overwhelmed, to prevent severe illness and deaths. And I know that all of us are now being touched by this personally and know people who have been hospitalized or even died. And so, again, it is not a hoax. This is real, and it's very serious. Where we're seeing the cases, the majority of cases are associated now with small and medium-sized gatherings of families and friends. Things like birthday parties, weddings, holiday gatherings, but then also gatherings in bars, restaurants, office break rooms. And as the judge mentioned, doing teleworking and those things to avoid the crowds are so important. People gathering with friends and families in their homes may think they're being safe because they aren't going out, but you're not. And in reality, these small gatherings are some of the most unsafe activities because they're the close contact that you're having with other people in those small gatherings. So at this critical point in the fight against COVID-19, we're hopeful that the citizens of Dallas will understand how serious this really is. We'll take all the necessary steps to reduce the spread in our community. We've said we know what to do, we just need to do it. We need everyone to reduce the number of interactions with other people and be very careful this holiday season by following the county's holiday guidance that is now on our website. Every time you can reduce your interaction with other people, please, you can reduce your risk of getting COVID. The judge mentioned some of the testing. We offer the testing for free at Ellis Davis Fieldhouse, Eastfield College. What we really recommend, if you are planning, again, we recommend it's not going to be a normal Thanksgiving or Christmas, try to do things distant, virtually. If you are planning having friends and family over at the holidays, we recommend, as the judge mentioned, the host and guests all quarantine for 14 days before seeing each other to minimize the risk of exposure to COVID-19. Now, as the judge mentioned, you can get a test, the type of tests we offer at Eastfield and Ellis Davis are the PCR tests. These are the most accurate tests available. But understand that getting a test has limited efficacy and helpfulness because it should not be used to replace any of the other safety measures and protective measures like quarantine that we're talking about, because a negative test in general only applies to the day that you get that test. It tells you something about the status, your COVID status on that day, but the next day you could become positive and become infectious. So, so that's really important to think about. You know, for example, if you got a negative test on Monday before the holiday, it does not going to guarantee that you would be negative on Thanksgiving Day. And even if all your guests had a negative COVID test, important for you to follow all the other strategies in our guidance. The masking, 6-foot physical distancing, and avoiding crowds, those are what everyone needs to do. And again, just want to reiterate, the lowest risk Thanksgiving plans are celebrating only with your immediate family, those that you spend time with all the time. Just last couple things, flu shot. That's something we do have a vaccine for. It's especially important this year. We don't want to have a bad flu season and COVID-19. You know, you don't want 2 serious respiratory diseases at the same time. And so flu shots are available if you got insurance at drugstores, grocery stores, retail stores, or for free over at Eastfield, Ellis Davis, Fieldhouse. Again, they're readily available. But also the things that masking and avoiding people are the same things that will also help prevent flu. So it's important dual effects. Last thing, just want to remind people we do still have our rental assistance program. The DCHHS is still accepting applications to our emergency housing assistance program. It's for residents of Dallas County who live outside of City of Dallas and have suffered financial hardship due to COVID. And so you can get rental, mortgage assistance. You can do it online and over the phone. And so you can get those on the DCHHS website. And applications are available in English and Spanish. So that's all I've got. Thank you.
I do have one other thing. In the stack of things they gave me as I'm walking in is a letter from our Public Health Committee that my office has just received in the last hour. And before we get to that, by the way, on the rental eviction assistance, if you got a notice of eviction, on the 3rd page of the documents that you got, it is an explanation of how you take a couple of simple no-cost steps, and then you can't be evicted until January 1st. So read the documents. If you are hearing my voice and you're having trouble understanding the documents, get some help. There on our website are a bunch of pro bono lawyers that will help you with that. But if you just fill out that 3rd page document and show up to the court with your declaration, they can't evict you until next year. Okay, so the doctors have unanimously requested, these are experts in infectious disease, public health, epidemiology. They've unanimously requested things. Most of these things will require action from the governor. But as we look at these, there are things that we can do. We don't have to wait for the governor to not go to some of these places. They are requesting that I continue to not allow bars to open, all bars to open. But they're requesting that the governor close the loopholes that have allowed bars to open by partnering with food trucks and other things. What you can do right now is stop going to those places because those are places of large community spread. They're asking that the governor look to close or allow us to close in-person dining inside the restaurant. But whether or not that is allowed or not, you can choose to eat on the patio at 6-foot distance or to use curbside or takeout. They're asking that all indoor and outdoor activities all indoor activities be limited to 10 people or less, and that outdoor activities, when you cannot be 6 feet apart or not, be 100% masked, be limited to 10%. So you can still have a larger outdoor activity with spacing and masking. They're asking that infection controls and visitation restrictions be looked at again in hospitals and long-term care. Not that there'd be no visiting, but that some of those loopholes would be tightened up. They're reminding us that it is their preference that we not do group classes in gyms, and that those should be closed and should be virtual only. Really, there have been strong recommendations from the Public Health Committee before not to do indoor exertion at gyms right now, and that still holds true. They're asking that we look at a retail business occupancy limit of 25%, that all other non-essential businesses look at an occupancy limit of 50%. Under the governor's GA 32, we would get back to a occupancy limit of 50%, but we would be in a much worse place before that would kick in. So we're trying to get that to happen now. They're asking that the school districts be given latitude not to lose TEA funding if they need to go all virtual in the week to 2 weeks after Thanksgiving. There's very much a concern that when you get everybody together, they don't listen to what we talked about today, you jumble them all up, you mix them together. If everybody's just around one more person than they're normally around, that's 2.7 million more contacts in Dallas County. If you're around 2, that's over 5 million, that's 5.5 million. If you're around 3 or 4, you get the picture, right? And so as we jumble all that up, being virtual after that, whether it be school or work, is very, very important. They point out that time is of the essence and that we cannot afford to wait until we are in the situation that El Paso got into. El Paso was finally able to do some of the things on this list when they hit the governor's thresholds. But unfortunately, El Paso's in a very bad place, and they got in that bad place about 2 days after they hit the governor's thresholds. So we need to go ahead and do that sooner rather than later. I will be reaching out to the governor. I'll attach their letter to a letter from me asking them to do as much as he can on this and do what they're asking. But further, we don't have to wait on any elected official to keep us safe. You can make that decision right now, that you're going to stop going to the bar, that you're going to limit those interactions, and that's what is going to be necessary, and you're going to wear that dang mask, and that's what's going to be necessary to keep your family, our community, and our economy strong. Any questions? Yes, ma'am.
Judge, I know bars aren't allowed to over here in Dallas County, but over the weekend I've seen videos on social media of bars and clubs just teeming with people. Is there any enforcement effort going on right now, or what can people do if they see that business is just, super full?
Well, so the cities where the bars are trying to enforce the occupancy limits. But we don't have bars open without those TABC loopholes here in Dallas County, because I didn't open them. The governor said it's up to the county judge, and I said no. So every bar that you're seeing open is used a workaround with Governor Abbott's office in the TABC. So other than catching them on the occupancy limit, there's really, on violence and things of this nature, it's limited what our cities can do. We're doing everything that we can to keep you safe, but we need the governor and the TABC to close those loopholes, obviously. It's important to remember a restaurant had a sign up a few weeks ago that said, your decision to wear a mask, your decision of where you go is yours and yours alone. Don't try to enforce it on anyone else. Sadly, now they've had 2 fatalities at that restaurant. But it's important for us to remember, sure, it's your decision to go to that loopholed bar because the governor says it is. But the impact that you have on the community, it's not just you that will run a risk. It's your grandmother, it's your coworkers, it's the kids in your school. It's a whole lot of people. So we need to move to a spirit of selflessness. Yesterday was Veterans Day, or maybe it was, day before yesterday was Veterans Day. And those veterans sacrificed a lot. I mentioned my adopted dad, Warwick Jenkins, fought in the Battle of the Bulge, and some of our veterans didn't fight in combat, but they still served the country. Great sacrifice. We're not asking a whole lot from you. It seems like we are, but we're asking you to wear a mask, stay out of the bars, and keep your contacts down for a little while longer. We've got this vaccine coming. It's not going to fix the problem overnight, but you can see light at the end of the tunnel. This is not gonna last forever, but it is gonna last for a little while longer. And you cannot say you're a patriot if you won't do the few things that need to be done to keep your community safe. Yes, ma'am.
So, when you look at the numbers, we've doubled since where we were at the beginning of October. Help people to understand how close Dallas County is in regards to the governor's threshold. And what's your message to him when you send this letter? So if we're at double 385, where are we in relation to his threshold versus what you would want?
So with his threshold, we are about little over 4 percentage points away from his threshold. His threshold is 15% of all beds, whether or not those beds can be staffed, because you may not have sufficient staff for the bed. And then you have to be above that 15% for 7 days. Well, what we saw in El Paso is once you get into, you have the sort of community spread where you're above 15% of your beds, it doesn't stay at 15% for 7 days, right? I mean, you're seeing this explosive growth now in the number of new cases each day. That doesn't necessarily translate directly over today to hospitalizations. First, I get sick in a lot of cases, then I get sick enough to go to the hospital. So, you know, if you follow that trajectory, if we wait until we're at 15% and then we wait 7 days after that to do something, it's going to be far too late, right? I mean, and I'm talking, you know, regularly with my counterpart in El Paso, and we do not want to be where they are.
Sure.
Yes.
El Paso County defined the governor's orders and ordered its own restrictions. Are you considering a similar order if the court say the El Paso order is lawful?
So what we're looking at now is we're reaching out to the governor and asking him to do some of the things that he can do to help along with our medical community, and allowing us the latitude to do those things. You know, as far as what will happen if he doesn't do that, you know, I don't want to speculate on that. But now is not a time for politics. Now is a time for us to work together. And we need to follow what these doctors are saying, right? Because if we've learned anything in Texas, what we've learned is these political half measures trying to do a little bit what your special interest groups want to do and a little bit what the medical group wants to do. It doesn't work because the virus doesn't care, right? The virus is only going to respond to what medically and scientifically works. If we only do a half measure towards the virus responds just like it did when the governor did his reopen Texas and we saw the big spike. Now we're seeing the big spike from opening bars and increasing capacity. These half measures don't work. It's time to follow the doctors and for us in government to act decisively to put in place the things that will keep you safe. Yeah. Any other questions?
I have one last question,
Yes,
sir.
sir.
How soon do we expect to reach the 15% hospital threshold for COVID patients in our region?
Yeah, I've read a lot today. Is that 7 to 10 days? Do you know?
It's hard to say for that
Yeah.
particular metric.
You know, I'd have to, I probably should defer back to the UT Southwestern Medical Modelers for that, so I'll have to get you an answer for that. So thank you all. Please be safe out there, and thank you for all that you do.
As a point of clarification on the compliance rate, where did those numbers come from, and when was the last time you looked at the compliance rate?
You want me to just answer that one? So the compliance rate, the compliance rate comes from a variety of factors. They're looking at cell phone utilization. They're looking at traffic data, survey data, the prevalence rate data from the study that UT Southwestern and others are doing, and other data. And so when we think about that compliance rate, don't think of it like there's one person out there that's 100% compliance, and there's another person out there that's 0% compliant. Actually, there's nobody out there that's 0% compliant, because when you're asleep in your own home, you're compliant. So when we think about this, I'm afraid one of the things that our community and our folks have done is they've said, well, I'm doing a good job. You need to pick it up a notch and do a better job. Well, frankly, folks, it's going to be a lot easier for those of you who are wearing your mask, who are thinking about these things, to improve than it is to convince your neighbor who believes the mask is an abridgment of their personal liberty or believes that somehow what is happening is not real. And so when we look at that compliance, if we increase our telecommuting, decrease our crowd size, and what that can look like is, for instance, if you were using a curbside pickup for your groceries, but now you're thinking, well, if people can go to bars, I guess I can go shop in the grocery store. I like to shop. That's an unnecessary exposure. If people were, exercising outside at 6 foot distance, and it's beautiful weather for that this time of year, but now you're saying, well, I think I want to go back to my class in the gym. That's an unnecessary exposure. It's not just going to bars. As Phil said, we're seeing most of our exposures are happening at home. Why is that? We'll stop and think about it. You probably know somebody who's been to a bar, but you probably know damn near everybody you know has socialized with somebody either at their own home or at someone else's home. And it's those interactions that are increasing. Along with people, we're about to bust out into Thanksgiving and, hopefully not, but Black Friday craziness. And that's all kinds of non-6 foot interactions that we've got to try to avoid. Any other? Yeah.
Texas is at the almost 1 million mark of cases. How do you hope to win back the messaging when it seems people have given up to COVID fatigue?
Well, North Texas and North Texans are resilient people. And, it's like everything else in life. We're not always perfect. And so what you've got to say is if you let your guard down in the past, what you've got to say is, hey, I let my guard down, but that doesn't define who I am. I'm gonna do what I can for my family, for my community. I'm gonna wear my mask. I'm gonna avoid those crowds. I'm gonna wash my hands for 20 seconds. Because I do understand that it's up to all of us, and it starts with me personally, to do the things that are necessary to keep this community safe. So if we renew that resolve, just like when you drop off your diet and you pick up a few pounds, but that doesn't mean you have to stay there. You can decide to take corrective action. That's what we need to do individually and as a community right now to curb the spread. Anyone else? Thank you all so much. Okay, now, somebody stick around because Eugenia is doing the Spanish today, right?
Yes.
And she's going to do a great job. Thanks, everyone.
Get a mic.